Good morning, Nigerians. Welcome to Central Focus. My name is Idris, your regular host on this program. With me in the studio is Dr. Yusuf Kekere, a medical practitioner and currently working with FCT Health Insurance. Doctor, you're welcome.
Thank you very much, Alaji Idris.
How is practice and family?
Practice has been fine. For family, we thank good.
All right. I know it has not been easy as a medical practitioner who face the challenges of individual health every day. And by virtue of the profession, who is into field, you people are prone to so many health challenges. Doctor, what do you have to tell us about public health and prevention of diseases? Looking at it from the angle of your own profession and the general public.
Thank you very much. It is a nice gesture to be here again. You have said it, but it is a wider coverage of teachings, public and disease prevention. But because of time factor and because of the general population that will be listening to our program, I want to be a layman. I want to be concise. I want to be direct. And then I am going to be very brief because time does not permit us to expatiate better. And people who will be listening to us not having to listen to what we have, to say.
But they should.
They should, but individual attitude, you can only advise to do so, but somebody may bring an
to take it in their hands.
Thank you very much. So, if I may tell you about disease prevention, it is an aspect of public health that has to do with multi-axial stakeholders. When I mean multi-axial, it has to do with government, it has to do with people. When I mean people, formal and informal sectors, and then it has to do with a lot of things from the aspect of medicine, holistically. I want to define disease prevention for you that it is an act by a way in which people act to reduce disease factor or to reduce disease onset or to reduce complication or in a way to manage complication if it has already set on. But I will not overemphasize disease prevention by not bringing hygiene, epidemiology, and the prevention itself. What is hygiene? When we say hygiene, it's a Greek word that has to do with a personal taking care of your body. It has a different aspect. We say we have a hair or scalp hygiene, we have nose and ear hygiene, we have oral hygiene, we have hand hygiene, we have finger hygiene, we have intimate hygiene, depending on which one you want to focus on. But basically, it is part of prevention and preventive medicine that should not be overemphasized. You can't neglect it. You can't explain disease prevention without mentioning hygiene. And then disease epidemiology. Epidemiology is an aspect of public health that has to do with disease spread control and then locating or identifying outbreak, then prevent the occurrence and a curative aspect of it all together so that there will be no space for disease progressing.
That is hygiene.
That is hygiene. That is another epidemiology which I told you. But for prevention, I will not waste your time on that. Prevention, they are step ladder form. They are staple aspect of action. We have primordial prevention, we have primary prevention, we have secondary prevention, we have tertiary prevention, and we even have quaternary prevention. Quaternary prevention.
Okay.
I will tell you everything that each prevention means today. When we say prevention, for disease to occur, there is what is called the predisposing factor. All right.
Go ahead.
Okay. For disease to occur, there is always a disease risk factor. This risk factor are the things we try to avoid so that there will be no stage for disease occurrence. What are the risk factors in this aspect? Anything you do, you advise people to do, and people take into action so that disease factor doesn't come into play. We try to
primary.
That is the primordial. When you try to make sure the disease factor or the risk factor for disease are not given opportunity to manifest in the first place. So we classify that type of prevention as primordial prevention. So anything you do to prevent the risk factor from occurring. In this aspect, we are not even talking about the disease. This is what the Western world are doing. They are not at the disease level, but in the low resource income countries like the West African countries, we are even at the level of tertiary or secondary prevention. But in the Western world, there are high level practices at the primordial, in which case the environment is set for risk factor not to occur.
Yeah.
Let's not waste your time. In the primary aspect of prevention, in this time, the risk factor of the disease are living with people. Like somebody who has started work recently, its salary is 1 million naira. You are advising the person that you know your salary is actually so fat, so try not to grow fat, try not to grow a sedentary lifestyle. You are telling them not to encourage risk factor for disease. So this is the primordial. But if somebody, because of a fat salary, because of affluent life, they allow themselves to fat up, they are actually they are providing a very fertile ground for a coronary diseases. They are preparing a fertile ground for diabetes mellitus to take part. So if people are living, or certain population are living with risk factors and obesity, somebody who smokes, somebody who drinks alcohol, they are living with risk factor, although it has not set aside a disease for them. This is primary prevention. It's an act of telling people that you already have the risk factor living with people, but you tell them to limit it, to minimize it, so that disease occurrence does not occur. In the primary aspect of prevention, that is where you will have a social aspect of it, economic aspect of it, and mental aspect of it. What do I mean by social aspect of it? It is set aside by the governmental intervention, in which case government provides law and policies that has to do with people and the do and the don'ts in the environment. And then we have economic factor by increasing the individuals' capital income of the people, economic power, purchasing power of people. If you don't have anything economically to take care of your health, or you don't have anything to invest in health, you will not be able to spend out of pocket when you are hit with a particular disease. So government has to make policies and law so that at the end of the day, people doesn't come up with a particular diseases. And then that's governmental aspect. Yes, that's governmental aspect. They have to make policies. Then in the social aspect, it has to do with health reforms, and then economic and health education, school programs, and what have you. Then we also have environmental by providing healthy environment for people so that the injurious agents are not in proximity with day-to-day activity of people.
All right, thank you so much.
That is primary. That is aspect of primary, the goal and the assertion of the primary prevention. Then in the secondary prevention, it has to do with prompt diagnosis of the disease and early treatment so that complication does not occur. What happened at the level of secondary prevention? If, for instance, you do screening programs for population, screening for them like a blood pressure checkup to avoid or to prevent hypertension, a blood sugar checkup to avoid diabetes mellitus, you do mammography to avoid breast cancer, you do colonoscopy for colon cancer, you do pap smear for cervical cancer. These are part of secondary prevention. You are trying to, if the disease, you catch them early, you give prompt attack.
So what about tertiary?
The tertiary part of it is when the disease has stayed and then you are trying to prevent complication. So you are actually treating the disease so that complication does not occur. The tertiary, and if does, the complication ensues, what by a way of rehabilitation and then vocational center for the injured workers.
Then finally,
the quaternary, I know you will not forget that one. The quaternary is when you have found somebody condition, when you have found somebody in a disease condition, some people, somebody is down with the disease, they want to over medicate, they want to over test. We call it over medication, prevention of over medication. And then people will try to combine orthodox medicine and the traditional medicine.
So that's why we call it quaternary.
It's quaternary. It's not because somebody have hit with a disease, then you are recommending 10 different investigations for somebody. You are giving 10 different drugs for somebody. You are combining traditional and then orthodox medicine
All
together.
right, thank you so much, doctor. Then you also made mention of, because of your response, you also made mention of environmental.
All right.
This environmental does dumping of refuse in the public, like what is happening in Abuja presently. How does it affect prevention of diseases?
Thank you very much. This is involved in the primordial and in the primary aspect of prevention of diseases. In the primordial, I told you, it's a message given to people to make sure risk factor for disease are not bring into occurrence, so that they don't set stage for diseases. What happened? What are the risk factors for disease? For instance, overcrowding, for instance, is a risk factor for occurrence. Then dumping of refuse, open dumping of refuse, is a risk factor. But when you tell, it is one side to tell people not to do so, it's another side for people to believe and take action on themselves. It is not only financial aspect of health prevention that you want to invest because you have money. You have to invest a good attitude into your environment, so that risk factor does not build up.
So you are telling me that government is making efforts to educate people on open dumping of refuse,
Of course, yes.
and people are failing.
People are failing.
So do you think there's a better way government can approach this issue?
The only better way government can approach this issue, let me make mention of realists and neoconservatives. Realists are people who try to follow what has already been established. They don't see future to be changed or to be modified. Neoconservatives are people who always think in their day-to-day living, they want to make some changes. Government can ideally and indirectly convert the population into a neoconservative. Always think of what you can do to better up your environment. Some quarter have said government should impose some sanctions, some punishment. I feel it is not the way. What if on the daily time you found people doing what is wrong into environment or breaking the rules against primordial and primary prevention, and then in the night when you are asleep or when the security are asleep and they still want to vent into what they want to do, if they are adamant in providing a risk factor in the environment, you can't stop it. You can't stop it.
Yes, I understand correctly. I understand correctly. But don't you think if the action come out to be the last option?
But before the sanction, there are a lot of things you can do. We can do radio programs. We can do TV programs as
But
well.
the government is not doing anyone.
Yeah, the government, they are doing a lot of things. Let me tell you, in Nigeria today, we have State Social Health Insurance Agency, we have National Primary Healthcare Development Agency, we have NEMSAS, we have BACPF. All these ones are government initiatives to make sure people have wider coverage for health.
And those agencies you mentioned are not just paper agencies.
They are not just paper agency, they are theoretical and practical agency that I can tell you I am part of some of them. So if government fold her arms and they didn't do anything, the condition would have been the same today. But because there are all these programs ongoing,
With what are facing currently,
of course they are ongoing. You can imagine that in Nigeria today, the power supply is at its minimal level. So how many people have access to light so that they can listen to radio for health education and health talks on radio and on TV programs? So it all has to boil down to the infrastructures that we are backed up with to be able to listen to what government is doing on daily basis.
well, people are still having light. People have light, and then people are with their phones.
I'm sorry, Alaji Idris, if you say people are having light, if you put this to public question, I'm very sure they will stone us from outside camera. People doesn't have light. I'm telling you the reality, because people have light. Like 3 weeks or 4 weeks ago, I was on radio station, on Master Radio, where we are educating people on what they need to do to come and enroll with state social health insurance, FCT, health insurance scheme. How many people have opportunity to radios? How many people have opportunity to light so that they can listen to the program?
When people don't have money, they prefer to go wherever they can afford and get themselves treated.
Yes, what you have as a condition, as a health challenges, you may want to go to primary health, you may want to go to secondary health, you may even want to go to tertiary institution, you may want to go to an alternative way, which a lot of people are doing outside, but it depends on the outcome. That is why we classify disease prevention to be primordial, primary, secondary, and tertiary, even though quaternary is part of it. So the outcome of the prevention of disease is the hallmark of what we are working or what we are aiming at.
Okay, okay. Thank you so much, sir. I also mentioned National Health
Insurance agency,
Insurance Agency.
yes.
I'm aware of that.
State social,
State
social health insurance agency, NEMSA,
the state level,
ACPF,
the NEMSA, and then BHCPF. This NEMSA and BHCPF, what are they doing?
Okay, thank you very much.
That have to do with public.
Thank you very much. When we say health insurance is a way of providing a financial security and a financial reserve for people, so that when they lack of money or the lack of fund and they lead to financial challenges, they can fall back to the contribution they have made as part of their health scheme. This is State Social Health Insurance Agency. In Abuja here, we have FCT Health Insurance. It is available in every other 36 states of the Federation.
How sure are you that it's available?
It is available.
Sponsored by federal government or state government?
It is sponsored by state government, but under the watch of National Health Insurance Agency. It's like a downstream of National Health Insurance Agency.
How many people that have patronized National Health Insurance Agency?
And people like
that is their immediate office.
Like yes, people from various aspects of services from their workplaces, which is formal sectors. They have a reserve or have been utilizing National Health Insurance Agency.
And it's effective?
It is effective. Some people are using the State Social Health Insurance Agency, which I'm part of in Abuja here.
Is the family involved?
The family I'm involved. My family is equally involved.
Now, what about the state government?
The state-owned government is what I'm telling you, State Social Health Insurance Agency.
Yes.
That is the scheme. It is available in all the states, which is under the watch of National Health Insurance Agency.
Okay.
So we have premium. It's like contribute amount of money. When you contribute amount of money, regardless of whether you have illnesses or you don't have illnesses, somebody else who falls sick is benefiting from that contribution or financial pool. Are you getting, which I initially said is financial security? And then if eventually you fall sick tomorrow, you will be benefiting from another person's contribution, so that you don't have to suffer from out-of-pocket expenditure.
All right. So thank you so much, Doctor. Then what is the difference between NEMSA, BHCPF,
okay, thank you very
and
much.
that of State Health Insurance Agency,
Okay.
National Health Insurance Agency?
Okay, National Health Insurance Agency is a federal governing body,
okay,
where it supervises the activity. It makes analysis for the activities of the Social Health Insurance Agency. Okay. The Social Health Insurance Agency is a branch of NHIE. What they do is like you
belong to the state.
Belong to the skill.
Okay.
What they do is to make sure you have a little contribution, you and your family or your dependents. At the end of the day, if such financial tool serves as a facility for you, you or any of your dependents fall sick, will benefit from such a contribution, and it lasts for 12 calendar months. And then what I mean by basic healthcare provision fund, it is another federal government program where 1% of consolidated.
Which federal government are you referring to?
Federal government of Nigeria. Nigeria.
Of Nigeria, our country?
Yes.
My own nation?
Yes. Basic healthcare provision fund actually spans from primary health, secondary health, and the tertiary institution. They actually work for preventive medicine, promotive medicine, curative medicine, and rehabilitative medicine.
So are you telling me that if I put call through to the public now,
yes,
that I will get response from people claiming that they are aware of it?
They are aware of it. Recently, not up to 4 weeks or 5 weeks now, we have conducted a nationwide validation program for everybody across the nation, 774 local government of Nigeria. It was announced on social media, and then people, because I told you before, maybe our attitude to healthcare services may have disappointed so many of us, and because of that, they don't want to listen or they don't want to believe in what government is doing.
Doctor,
the CPF, they are for people for 0 naira. Even at the level of primary health care, we pay capitations on monthly basis. We prepaid this money so that we paid November in October, we pay December in November. We are even preparing to pay January now in this December, so that the money will be there for you, for people to access care, so that out of stock problem will have to be completely eliminated. If at the end of the day, what brought an enrollee to the hospital is beyond the limit of primary health care provider, they refer to secondary health care facilities.
And you said
it's 0 naira. Enrollee or the citizens of this country, especially the people that are under the eligibility coverage, the vulnerable, the under 5, the pregnant women, and the elderly, which is the geriatrics. If you fall into this eligibility criteria,
Doctor, is there any program that Nigerian government ever run that is free?
of course, yes.
Then how come we go to hospitals and there's no drugs?
When you say we go to the hospital and there's no drug,
During
let me put it to you again. I like
Okay.
this. When was the last time you go to the hospital?
But I use private hospital.
You use private hospital.
Yes.
Are you on any health insurance?
That is the one I use.
Okay, if you're on any health insurance, for instance, health management organizations, they also do the same thing. They cover some certain diseases. They cover some certain curative medicine. They cover some certain preventive medicine, but they don't cover everything. But BHCPF, as I'm telling you here now, it covers everything except some gray area where we think it will be too much for what is available in the pool, and then we still don't have completely eliminated such.
Are you telling me is it a newly established government agency?
It's not a
introduced by this current administration.
It's not a newly established. It has already been there before this administration. Okay, it's a federal government program to make sure the fairness of the private healthcare is improved, and to make sure the wider health coverage is taken to the doorstep.
Meant for the public or certain individuals?
It's not certain individual. I made mention of eligibility criteria. If the people are under 5,
that can be on paper, but the reality is not there.
the reality is, go to any primary healthcare facility, you will see BHCPF in. Go to secondary healthcare facility, you will see BHCPF register, referral register in action. Go to tertiary institution like hospitals, medical centers, you will see BHCPF in action. I'm not just telling you this story because I read on paper. I am an active member of such. That is why I'm very confident in telling you this.
Okay, thank you so much, doctor. Then you also mentioned of NEMSA.
NEMSA,
I have forgotten.
NEMSA is National Emergency Management and State Ambulance System. NEMSA, National Emergency Maintenance and then Ambulance System. Emergency Management Services and Ambulance System. NEMSA was recently introduced by National Health Insurance Agencies, in which case every emergency is taken care of, provided it is mobilized by an ambulance, and it is regardless of where the emergencies happen. The government, federal government, have taken it upon themselves that for 48 hours, efficient, quality, and then good outcome of such patient is going to weigh heavily on their shoulder. Then after then, the relative of the enrollee of the patient can take over from there. Of course, you and I know that the first 48 hours in an emergency patient matters.
In Nigeria, where patient is brought on hospital and their doctors are asking for the police report.
As long as it is an emergency, go to any hospital. I am telling you, NEMSA is not on paper. NEMSA is working.
As Nigerian government attached police station to the hospitals,
I am telling you,
so they can give reports.
NEMSA is working. I don't want to categorically my point of input. It is where or function or activity form part and parcel of. So the financial dynamics and the fiscal aspect of NEMSAs, I am part of it, because if you bring your bill from health services arena, either secondary or tertiary institution, it passes through our office, and we are the one paying. I am telling you, NEMSA is working.
That is for FCT.
It is not for FCT. It is a federal government initiative.
Does it cut across other states?
It cut across other states. It's not only in Abuja, this NEMSA is
working. I want to know that we have 36 states. And FCT as the capital, making it 37.
Yes.
So not necessarily mean I have to call from Abuja. I can call anybody from Sokoto.
You can call anybody.
I can call from Bayelsa.
You can check from your phone. You just type NEMSA, you will see what we stand for.
Doctor, I'm talking about practical issues, not paper.
When I mean practical, you just go to the hospital. People are benefiting from state social health insurance agency. People are benefiting from PHCPF. People are benefiting from NEMSAs, and people are benefiting from National Health Insurance Agency.
But doctor, before you continue, I want you to know that my viewers are listening to us.
All right.
And we'll have feedback. Okay. So the chances of coming back to repeat the same you said now is high. I can call you upon to come back and repeat the same thing you said.
You can put me on air anytime. I can even put you through. If you go to the hospital, ask patients one by one, What program are they benefiting
Should
from?
we conduct a research about it?
We can conduct a research about it. If you're conducting a research, I want you to start from my office.
That is your office who is claiming to have a free service to Nigeria.
You can start from my office, you can start from any other person.
A nation where everybody is crying left and right, day and night.
I'm telling you that government need to make or modify health education and then every other thing impossible, so that every other thing possible, so that at the end of the day, people are aware that such programs are ongoing.
Okay. I am giving you a platform
Okay.
to publicize this program
Okay.
across the statistics of all the federation, including FCT.
Okay.
But we'll discuss about that.
Thank you very much. If at the end of the day you want to put me on a research that will work the effectiveness of this program I've made mention of, I'll be very happy. It stands another avenue, another chance for people to know that government doesn't just fold their arms and watch Nigerian citizens suffering from different illnesses. And at the end of the day, we are not here to advocate for government. It is not to say that government is not.
No, I know you're speaking for a profession.
It is
As
not,
a medical practitioner.
it is not to say government are not doing well, but they can improve through health education, through laws and policies reforms concerning health.
This is one of the responsibilities of the government, which I believe, as you said,
And they are doing
if
it.
true,
And they are doing it.
then they should be applauded.
They are doing it. What they need to do is to step up the activity, especially social media campaign, so that people can get to know that such programs are ongoing.
Okay,
And they are
Market
beneficial.
Square, and I believe schools and all that, offices.
Yes, we have, from where I work today, we have different units. Different units, I can tell you, we have marketing unit. The marketing unit are spreading, promoting the image of FCT health insurance. They go to the market. Like last week, Friday, upon Friday, about 10 days ago now, we were in a Gariki International Market where we conduct a free medical outreach for people, let them get to know that state social health insurance is in its full-fledged to help citizens of Nigeria. We do a lot of medical checkup there that day, and then we do diagnosis, and then we give medications. We do a lot of things, so many programs. In fact, the permanent secretary on health, FCT, was in present. The director, FCT Health Insurance, was also in present. These are people, especially the marketing unit, goes to the market, to the school, to every other places to make sure people are aware that such program is ongoing and is beneficial.
Doctor, I want you to know that I am not attacking you.
Okay?
And the fact that my children have not confirmed any of such in their schools, that doesn't nullify the effort of the government. But in the situation a pronouncement is being made, and the only way you can assess it is so far, then automatically get the TV Nigerians. I want you to know that we don't have any other nation to try on.
Except Nigeria.
Yes. So whatever you are saying, people are listening to you.
People are listening to me, I'm very sure.
And public health and prevention of disease, either medical or non-medical personnel, we are all stakeholders in it.
We are stakeholders.
Because whenever there's an outbreak of disease, those who said will have to visit hospital. The doctors who are the patient are also at risk. So if you are telling me that even the program run by the Nigerian government that we all know that from the beginning of everything to the end, it is complaint about complaint. And Nigerian government have not come out publicly to take responsibility and say, yes, we admit that we have gone so many things wrong.
That's why, if you allow me to speak, that's why I tell you, Nigeria have stopped being a realist. You don't have to do what you do yesterday on daily basis. You look around, you compare what you are doing, what other people are doing within Nigeria and outside Nigeria. It makes you a new conservative. Then you can verify what you have been doing. You listen to people's complaint. Go to the hospital. Ask a question. What you are supposed to be given that you were not given. What you are supposed to be, how were you supposed to be attended to and were not attended to. Get this complaint from patients and come back to your own research unit and formulate an order or a policy or a law that will best suit into what the citizen of Nigeria wants to get.
Okay, thank you so much. So what do you think is the role of community and the government? How do you think both can work together, including our kings?
Okay, chiefs. Well, government, I made mention of a primordial, they form part of it. primary, they form part of it, especially in the vaccination/immunization program.
The reason why I asked you the question is that as a medical practitioner, you know the method you can design to bring in community through their kings who have the authority to summon the community and give them an advice for orientation about the government activities.
It's all right. I would like to still illuminate my past approach that government, in their magnanimity effort, for instance,
Is it magnanimity?
it's magnanimity. Honestly,
So Nigerian government is not owing any responsibility at all.
it's owing responsibility. But there are governments that have failed to do their responsibilities. If a government is setting aside a magnanimity program. When we say magnanimity program, they can also come up and tell you that this program cannot be achieved because of one excuses or the other. Let me tell you, whatever government is doing for her citizens, there are places that government have the resources and they are not doing it.
No, so
Take for instance, why I use that word magnanimity. We have had a lot of government that come into system and they didn't do they are supposed to do. We have the resources even to start, if not to do everything that we need. Government start, another government propagate it, another government can take action from where the last government stopped. But we found a government that is doing one to the other to benefit citizens. We have to put it as a way of magnanimity. If they don't do it, you want to question them. How are you going to attack them? Let me tell you that government will still be there for us in formulating policies and law. It's up to us. Our attitude is so critical, it's so rigid that if you correct somebody on the street, in fact, they can fight you. Why? Because they are so rigid in forming to the policy and the law government has set aside to make sure our environment is good, a habitable one. Come to the community. There's what we call community initiative. Think about our environmental sanitation. What happens to it? Some states are not doing it. Then that Saturday that we are not doing it, what are we doing?
what I know is that the federal government, whether state level, local government, or at the federal.
Let me tell you, when we were very small in our villages those days, every Saturday, it is a day for environmental sanitation or not. We already have the idea that every Saturday we have to weed, we have to sweep, we have to wash, we have to clean, we have to do all things to make the house yourself and they're clean.
So does this draw me or draw us to this activities used to happen in primary school before? When we talk about personal hygiene, where during the assembly ground, then students are asked to show their fingers
Yes.
and all that.
Yes.
I believe you have such experience.
Of course, we were examined when I was in primary school, where you show your finger, you show your teeth, you come for a teacher to see you. If your trouser, your shirt is dirty, you are punished for that. Next week, you don't do that. But let me
I believe it's part of the community
it's part of
orientation.
yes, part of the community. That one we call it health education, a health, personal hygiene. You understand? It is a background knowledge that people have to get to use to.
That community will come by collective effort of environmental hygiene. Because I believe that is one of the factors to spread diseases.
The fastest way to spread disease is not environmental. It's not environmental sanitation. The fastest way to spread disease all boils tailored to our attitude. What you need to do to make sure environment is clean, to make sure you are good, to make sure you are not disease prone, all boils or tailored down to attitude. How many times government have sent law policies as regards prevention of disease and we are not doing it? So what do you want government to do? Like in our drainage system today, people have converted our drainage system into a dumping ground so that during every rainfall, water misses their way, they can't pass, and then they divert it into their running way. They enter into houses, into shops, into different night in the environment. We call it a flood. We shouldn't have been having flood because government are trying all around to make sure drainage systems are being constructed, but people converted it into a dumping ground. What do you want government to do aftermath of this?
No. So that is what I mentioned at the beginning of this program. That don't you think the government should impose sanction on this? But however, what is your advice, your final word?
Government should continue to do health talk health program on radios and on TVs, go to schools, go to market, go to mosque, go to church, so that they continue to repeat it again. There is always a power in what you do repeatedly.
So are you telling me now that the those leaders, the traditional leaders, have critical roles to play?
They have critical. In fact, they have to
The market leaders,
they have to converge. They have to converge for workshop training as regards health prevention, disease prevention. They have to have a critical training, workshop training, no matter your position in the society.
all right. Thank you so much, Doctor, for your time.
Thank you very much.
I really appreciate your response.
Thank
And I hope and I believe that in a short while, I will call you back for continuation of this discussion.
Thank you very much.
Thank you so much. My viewers, doctors have cleared the government, and I believe that it is our own responsibility as well to appreciate what government have done by trying as much as possible to save ourselves from spread of diseases and other activities that have to bring good environmental hygiene. Thank you so much for your time, doctor.
Thank you very much.
Thank you, my viewers, for your time.
Thank you very much.